Stop believing that your daily walks are keeping you safe. That might sound harsh, but orthopedic surgeons see the reality of that misconception every single day in the operating room. Are you over 65 and convinced that your morning stroll around the neighborhood is enough to keep your body healthy, strong, and resilient? Do you truly believe that simply putting one foot in front of the other is protecting your joints, preserving your muscle mass, and ensuring your independence for the next 20 years? If so, you need to hear what surgeons who operate on seniors every day have discovered. The medical reality is clear. Walking is not enough, not even close. Orthopedic surgeons are the doctors who repair broken hips, replace worn-out knees, and fix fractured spines. They see a disturbing and repetitive pattern. Patient after patient arrives for surgery, and when asked about their exercise habits, the answer is almost always identical. "I walk every day. I thought that was enough." Walking is a wonderful activity for heart health and general mental well-being, but it fails to address the three critical factors that determine whether you will remain independent or end up needing surgery, assisted living, or round-the-clock care. First, walking does not build muscle. It merely maintains a baseline. Second, walking doesn't improve bone density in the way your skeleton requires. Third, walking only trains you to move in a straight line. But life and falls happen in multiple directions. Today, we are revealing 3 surgeon-approved exercises that deliver exactly what walking cannot. Exercise number 3, wall push-ups. Surgeons who perform shoulder replacements and repair rotator cuff injuries have noticed an alarming trend. The seniors who end up on their operating tables almost universally have severely weakened upper bodies. Because walking does absolutely nothing for your arms, shoulders, chest, or upper back, these muscles undergo muscle wasting over time. Think about what happens during a fall. Your arms instinctively reach out to catch yourself. Your shoulders must absorb the impact. Your chest and back muscles work to stabilize your frame. If these muscles are weak, a simple trip doesn't just result in a bruise, it results in a broken wrist or a fractured shoulder. Surgeons recommend wall push-ups as the safest, most effective way to build protective upper body strength after 65. The surgeon-approved technique. Stand facing a wall, approximately 1 arm's length away. Place both palms flat against the wall at shoulder height, with your hands positioned shoulder-width apart. Keep your body straight from your head to your heels, engaging your core muscles so your hips don't sag. Slowly bend your elbows and lean your upper body toward the wall in a controlled motion. When your face comes close to the wall, pause briefly, then push yourself back to the starting position. Begin with 5 to 8 repetitions and gradually progress to 15. This exercise is surgeon-approved because it has a remarkable safety profile. Unlike floor push-ups, the wall version places minimal stress on your wrists and lower back while still providing enough resistance to stimulate bone strengthening. Within 2 months, you will notice that carrying grocery bags becomes effortless and opening stubborn jars requires less struggle. Most importantly, you are building shock absorbers for your joints. Exercise number 2, chair squats. Orthopedic surgeons specializing in hip and knee replacements often state that many of their surgeries could have been prevented entirely with proper leg strengthening. There is a critical distinction you must understand. Moving and strengthening are 2 completely different things. Walking uses your legs at a very low intensity. It maintains function, but it doesn't build the strength reserves your body desperately needs. When your legs lack true strength, your joints compensate. Your knees absorb forces they weren't designed to handle, and your hips work overtime to stabilize you. Over decades, this wears down cartilage and leads to the chronic pain that eventually requires a surgical replacement. Chair squats are the solution. This single movement strengthens your quadriceps, hamstrings, glutes, and core all at once. The surgeon-approved technique. Stand in front of a sturdy, stable chair with your feet shoulder-width apart. Extend your arms straight out in front of you to act as a counterweight. Begin lowering your body slowly by bending your knees and pushing your hips backward as if you were about to sit down. Control your descent until your bottom lightly touches the seat, but do not fully sit and relax. Immediately push through your heels and drive your body back up to a standing position. If this is too hard at first, surgeons say it is perfectly acceptable to sit down completely, pause, and then stand back up. The goal is the sit-to-stand motion, which is arguably the most important functional movement for maintaining independence. When you no longer get out of a chair or off a toilet without help, your independence slips away. One prominent surgeon stated that if every person over 65 did chair squats 3 times a week, his surgical caseload would drop by 30%. Exercise number 1. Seated marching. This final exercise is the one surgeons consider absolutely essential for every single person over 65. It is the starting point for those who have been sedentary, those recovering from illness, or those who feel too old or too weak to exercise. If you haven't exercised in years, this is your gateway. Seated marching is the safest and most universally beneficial exercise for older adults. It provides cardiovascular benefits without any fall risk, strengthens the hip flexors, the muscles that lift your legs over obstacles, and improves the neural connection between your brain and your limbs. The technique: sit upright in a sturdy, stable chair with your feet flat on the floor. Hold the sides of the chair seat for support if needed. Begin lifting one knee upward toward your chest as high as is comfortable. Lower that foot and immediately lift the opposite knee. Continue this alternating rhythmic pattern as if you were marching in place while sitting. Start with 60 seconds of marching, rest for 30 seconds, and repeat. As you get stronger, you can increase this to 5 minutes. Surgeons prescribe this to post-operative patients to prevent blood clots and maintain muscle function, but you shouldn't wait for surgery to start. This movement has transformed people from being wheelchair-bound to walking independently. It is gentle enough for those with arthritis or heart disease, yet effective enough to produce measurable improvements in coordination. Surgeons spend their careers repairing damage that often could have been prevented. They see the consequences of muscle weakness and bone fragility every day. Their message to you is simple: your body requires more than walking to remain stable and independent. These 3 exercises fill the critical gaps. Wall push-ups protect your upper body. Chair squats preserve your leg joints. Seated marching builds the foundational coordination and circulation your entire system needs. You don't need a gym membership, expensive equipment, or prior athletic experience. You just need a wall, a chair, and a few minutes of your time. Consistency matters far more than intensity. Performing these 3 movements for just 10 minutes daily provides more protection than an hour-long session once a week. Make them as routine as your morning cup of tea. If you've been inactive, start with seated marching alone for 1 week. Once that feels natural, add the chair squats. By the 3rd week, incorporate the wall push-ups. Every wall push-up you perform today is upper body strength preserved for tomorrow. Every chair squat is another day of independent living protected. Every minute of seated marching is a reduction in surgical risk. Surgeons cannot force you to exercise. They can only fix the broken pieces after a fall occurs. But you have the power to prevent that damage from ever happening. Don't wait until you're on an operating table wishing you had done something differently. Don't wait until a fall lands you in the hospital. Your future self, the one still traveling, still playing with grandchildren, and still living in their own home, will thank you for the decision you make right now. Take action today. Start with seated marching. Add the squats when you're ready. Incorporate the push-ups to complete the routine. If this surgeon-approved information has changed your perspective, please hit the like button and share this with friends who still think walking is enough. Leave a comment below telling us which exercise you're starting with today. We love hearing about your journey toward a stronger, surgery-free life.